I'm going to share with you 8 strategies that can decrease the use of psychiatric medications in children. It's very important that you review this information very carefully and watch the video until the end, and review the information with your family doctor. Never stop psychiatric medications without talking with your child's family doctor or your child's pediatrician. The first strategy is the use of self-help books. Self-help books can be very powerful in the treatment of several psychiatric disorders. For example, there was a study that showed that by reading the book Feeling Good by Dr. David Burns, almost 70% of the patients overcame the depression just by reading this book. This is a book that it's very hard for a young child or young teenager to read. But there are other books that can be read by young children or teenagers with the help of their parents. I include a list of excellent self-help books in the video description. Please don't forget to review the terms of use of this video in the video description too. Dr. David Burns is also the author of the books When Panic Attacks and the book Feeling Great. The book Feeling Great is the book that I prescribe the most now for older teenagers and for adults who suffer from depression and anxiety. I see mostly children and teenagers in my office, but I have seen dozens of times that when the parents read the books that I recommend to you, they also improve their mental health. Most of the times, it's better that the parents read the self-help books from the list with their children and teenagers. So not only their children and teenagers read the book, but it's better if the parents read the books together with them. For example, parents can read together with their teenagers' children the book Feeling Great by Dr. David Burns. It can be a lot of work to read this book because it's a very big book. So I typically recommend for parents to read this book with their older teenager children over 4 to 6 months. One strategy to consider is to use the audiobook with the paper book together and listen to the audiobook about 15 to 20 minutes each day and follow the paper version. By doing that, the parents and teenagers will learn amazing skills together, skills that will help them overcome depression and anxiety problems. I provide additional important information about this book in the video description. Another very powerful strategy to reduce the use of psychiatric medications is parents attending parenting programs. Studies indicate that when parents attend evidence-based parenting programs, like the CASD method for parent-defined child, or the PPP, the Positive Parenting Program that was developed in Australia, the children are less likely to develop anxiety problems and less likely to develop oppositional-defined disorder. So the parenting training works for a few psychiatric problems, but not for all the problems, of course. If the children already have opposition-defined disorder or anxiety problems, the parenting training can help to decrease the severity of these problems. And also, studies indicate that it can improve the behaviors of the other children in the home. And additionally, studies indicate that by attending parenting programs, the parents' own mental health can improve, increase the chance, for example, that the parents will overcome depression if they're suffering from depression. Okay, so you already mentioned 2 strategies. We mentioned that self-help books are a very cost-effective intervention that can help several children, teenagers, and adults improve their mental health. It's not a resource that will fix everything, but it can help in several disorders, including anxiety, depression, and it also can help children to learn coping strategies for ADHD, and can help parents and children learn strategies to cope with OCD, obsessive-compulsive disorder, and other psychiatric disorders. Again, you'll find the list that I created with a list of excellent self-help books in the video description. The second strategy that I mentioned today is the parenting training. Parenting training can be learned with a certified mental health provider, by parents reading a few parenting books, or through online courses. And fortunately today, there is even one program that's excellent and also free. It's a program developed by Dr. Kasdan and is available on Coursera. The program is called Everyday Parenting, the ABCs of Child Hearing. The link for this program is available in the video description. Now, let's talk about the third strategy. The third strategy is to be careful not to overlook children's learning disorders. One thing that I learned early on in my career as a child psychiatrist is that very frequently children develop worse mental health because they have learning disorders and the learning disorders were not properly identified and addressed. I have been a child psychiatrist now for 16 years. I observed early on in my career that very frequently in child psychiatry inpatient units here in North America, that we have a few of these units would be sometimes empty during the summer break months when the children are not at school. And right after the kids go back to school, after the end of the school summer break, several children's mental health problems appear to get worse, and at times even would lead to psychiatric hospitalizations. What I observe is that several of these children have learning disorders, like reading and math learning disorders, and were not diagnosed yet. This could lead these children to have very significant suffering that lead them to develop worse anxiety and worse mood. So one very important strategy is that parents should talk with school team about the likely benefits of their children having an education assessment to help rule out learning disorders if their children are struggling academically. And if your child does have a learning disorder, it's very important that you talk with school team about the implementing appropriate supports for your child so that your child will learn more effectively and will be less stressed to attend school. Ideally, we'd like all children to be screened for learning disorders by school team early on in elementary school. It's not a good idea to wait, let's say, until a child starts to struggle with severe depression, anxiety because of an undiagnosed learning disorder, and then, only then, to check if the child has a learning disorder. If we intervene early and by these children being identified earlier and receiving appropriate supports, it will be less likely these children will suffer from years because of their learning disorders and will be therefore less likely to develop depression and anxiety. By identifying learning disorders early on, we can help children and teenagers avoid unnecessary suffering. Now let's talk about the fourth strategy to decrease the use of psychiatric medications in children. The fourth strategy is daily physical activity. Studies indicate that daily physical activity can help children, teenagers, and adults have better attention span and can also be helpful in the treatment of depression. We typically recommend that families take their child first for an assessment with their family doctor or pediatrician to check if there's any kind of physical activity in which the child should not engage. So again, engaging in regular physical activity can be a very powerful way to improve children's mental health and at times to the point that will decrease the use of psychiatric medications in children. That was the fourth strategy. Let's repeat now the strategies that we covered so far. These are very important strategies, so I want to be sure that you remember all the strategies. Okay, so the strategies that we covered so far are 1. The use of self-help books. 2. Parents to attend parenting training. 3. Identify learning disorders early. 4. Daily physical activity. Now let's talk about the fifth strategy. The fifth strategy is to pay careful attention to children's sleep quality, including children not using a cell phone or a tablet before bedtime. The bright lights from tablets and cell phones can disrupt children's sleep and can inhibit our brain from releasing melatonin. The melatonin is a hormone that helps prepare our body to sleep. So, if you use a cell phone before bedtime, our body does not release melatonin when it should, and we don't sleep well. And if we don't sleep well, we develop worse attention span and worse mood. There are children, teenagers, and adults too, who may have primary sleep disorders. It's very important that we pay really good attention to our sleep, both for the children and our own sleep too. For example, if your child is waking up tired, this is a red flag that maybe your child has a sleep problem. So it's very important that you talk about this concern with your child's family doctor or pediatrician. Your child's family doctor or pediatrician may consider referring your child to a sleep study to help rule out sleep problems like obstructive sleep apnea. Sleep apnea is a disorder when children, teenagers, or adults have frequent obstructions in their airways while trying to sleep. People with sleep apnea frequently snore during the night, but there are people with sleep apnea who do not snore. Again, paying careful attention to your children's sleep, and if your child is not sleeping well or waking up tired, talking with your family doctor. That was the fifth strategy. In the video description, I included additional resources for you to learn about sleep problems in children. Now let's talk about strategy number 6, that is to do blood tests. So, to do blood tests, why? Okay, let's talk about it. A few children and teenagers may have depression or anxiety or other psychiatric problems because they have undiagnosed medical problems. For example, anemia or thyroid problems. The thyroid is a gland here on our neck and sometimes does not work properly. And this can lead to psychiatric problems, including depression, or a few children may become more irritable and have poor attention span. So paying careful attention to our general health is very important. And a few studies indicate that when we receive a psychiatric diagnosis or when we doctors give our patients a psychiatric diagnosis, we frequently stop thinking medically. We don't want to make this mistake, so this is why I mentioned this here. If you received a psychiatric diagnosis, like depression for example, we have to be careful not to overlook medical problems that could be contributing to depression. So we should always be alert for that. And especially if, let's say, if you are feeling tired or losing weight or gaining weight, it's very important that you mention that to your family doctor. So your doctor may consider ordering lab tests or check for other health problems. And we have seen in our offices that at times children come to see a psychiatrist and we recommend lab tests. And sometimes we find that the children have or teenagers have anemia, thyroid problems, and other health problems. So this does happen. So it's very important. If your child receives a psychiatric diagnosis, it does not mean you should not continue thinking medically. Sometimes children have health problems. We should not overlook the health problems. And typically, once these health problems are treated, the child's mental health will improve. For example, the children's attention span may improve and their mood may improve. So again, it's very important that we don't forget our body. If our body is not healthy, our mind will not be healthy either. That was strategy number 6. Let's review now the first 6 strategies. So the strategy number 1 is the use of self-help books. The strategy number 2 is parents using evidence-based parenting programs. The strategy number 3 is to be careful not to overlook learning disorders. The strategy number 4 is daily physical activity. The strategy number 5 is to pay careful attention to your sleep quality, including having good sleep habits, and sometimes there is also the need to check for sleep disorders. If this is what your doctor recommends, talk with your family doctor. The strategy number 6 is not to overlook medical problems. Check with your family doctor if you need lab tests. Not all patients will require lab tests, but teenagers and adults who develop depression frequently need lab tests to rule out anemia and thyroid problems, and sometimes other lab tests to rule out other health problems. Now, let's talk about strategy 7 and 8. The strategy 7 is to try to decrease the use of social media. We're seeing more and more children and teenagers who are developing worse mental health because they're using social media excessively. Children and young teenagers probably should not use social media at all. They are not emotionally prepared for it. Unfortunately, a very common situation that we observe is that children and teenagers using a lot of social media and they keep comparing themselves with other children and teenagers, and especially for young girls, this appears to be especially negative. It can be very bad for boys too, but a few studies indicate that this excessive use of social media appears to be especially more harmful for girls. And also, frequently these teenagers use this social media on their cell phones. So their use of cell phone may disrupt their sleep too. Frequently, they are on their cell phones at night just before bedtime, and the bright screens can keep them up. So the social media can be bad in two ways. It's bad when we keep comparing ourselves to others, and it also can be bad because the bright light from the cell phones and tablets can disrupt our sleep. Having said that, we usually don't recommend for parents to prohibit their teenagers abruptly from using social media. If your child or teenager uses social media excessively, ask the assistance of a mental health provider. That was the 7th strategy. Now let's talk about strategy number 8. The 8th strategy to decrease the use of psychiatric medications is children and teenagers to attend counseling sessions. Counseling sessions can be very helpful for several psychiatric problems, including anxiety problems, depression, and other mood problems like bipolar disorder, and can be very important for eating disorders and other psychiatric disorders. What we know is that to overcome depression and anxiety, we have to learn to think differently with the use of self-help books or psychotherapy sessions. We learn to change the way you think. Psychiatric medications can be very helpful for several children and teenagers, can help them overcome depression, anxiety, and other psychiatric problems. What studies indicate, however, is that if you only take the psychiatric medication, for example for depression and anxiety, and you do not attend psychotherapy sessions or do not use the self-help books, when you stop using the medications, there's a high chance that your anxiety or depression will come back. But if you attended psychotherapy sessions and used the self-help books and you did that seriously, right? You really meant business. You did really seriously. You did the homework from the psychotherapy. Then you have a much lower chance of the anxiety problems and the depression coming back. Dr. David Burns authored the book Feeling Good, book that I mentioned earlier in this video. The book that studies indicate 2/3 of the patients who read this book overcame depression just by reading it. Dr. Burns indicates that he has observed that the strongest predictor for patients overcoming depression and anxiety is they doing the homework of the psychotherapy. So the patients who do not do the homework, like the exposure therapy for anxiety problems or filling the forms for depression and anxiety, they usually do not overcome depression or anxiety. So the strategy number 8 is that counseling sessions can be very helpful to treat several psychiatric disorders, including anxiety and depression. Ask the advice of your family doctor to locate a good counselor in the region you live. There are a lot of good counselors out there, but not all the counselors are good, and sometimes, unfortunately, we hear about counselors that are not good at all. So it's very important that you ask your family doctor for advice. The family doctor cannot promise the counselor will be a good counselor. Nobody really can promise that. But by you taking the time to trying to do some research, by talking with the doctors or checking for the counselors in your region who have a good reputation, it will increase the chance that you're going to find a good counselor for your child. That was the 8th strategy to attend counseling sessions. So again, repeating all the 8 strategies to decrease the use of psychiatric medications in children. Strategy number 1 is the use of self-help books. Strategy number 2 is parents using evidence-based parenting programs like reading the book The Kesey Method for Parenting a Defiant Child. Strategy number 3 is to pay close attention to your child's learning, and if your child is struggling with their learning, to talk with school team. Strategy number 4 is daily physical activity. Strategy number 5 is pay careful attention to our sleep quality. Strategy number 6, don't forget the body. Check with your family's doctor if your child needs any blood tests. Strategy number 7 is to decrease the use of social media in children, teenagers, and probably also in adults. The strategy number 8 is to attend counseling sessions, also called frequently talk therapy or psychotherapy sessions. Don't forget to subscribe to continue receiving our videos. Check these other videos at Mental Health Secrets with Dr. Tavares to learn more. Thank you for watching.